Hi, I'm Becky DPT. Today, let's talk ice versus heat. Which one's better and when to use them? Ice should be used after an initial injury. So if we twist an ankle, if we fall on a wrist, fall on an elbow, any initial injury where you get that swelling, you want to use ice for 48 to 72 hours because you're trying to get that blood flow out of there. When you initially hurt something, your fighter cells go to that area and things become very inflamed. So you want to push some of that increased swelling out of there. When you have those little fighter cells go in there and you get that swelling, you have pressure on nerves. So you get that achy, dull pain, pressure on the muscles, pressure on the nerves, and that's what you want to reduce. You can make your own ice pack by using 2/3 cup of water and 1/3 cup of rubbing alcohol. You mix them together, it becomes nice and slushy. Normally, I like to tell my patients to use a Ziploc bag and to double bag it so that it makes it nicely conformed against maybe an elbow instead of just being a block of ice. It conforms around that elbow. You can also use a bag of peas or chopped up carrots because you can kind of break that up and put it on an elbow or a knee to conform. Icing should be done anywhere from 3 to 4 times a day and for 15 to 20 minutes each. During this phase, you can also use the rice method. So you rest the injury, you ice it, you compress it, possibly use an ACE bandage to wrap it, and then you elevate to help get that inflammation out. Heat should be used beyond that 72 hours. Sometimes you might need to use that ice for even longer, depending on the inflammation, because we don't want to increase that swelling. We want to push that swelling out of there, because a lot of times we can't even figure out how bad something is torn or hurt if we have that inflammation in there because it causes a lot more pain. Heat should be used beyond that 72 hours so that you can increase that good oxygenated blood flow to that area. So by increasing the blood flow, it brings that nutrient-rich blood into that area so it can really help to move the injury along and to help heal the injury. Heat should be used about 3 times a day for 15 to 20 minutes each session. Of course, heat nor ice, you don't want to put it on an open wound. If you have an open wound, it needs to be sealed or closed over, either by a bandage, sutures, before anything is put on there. And you should always have something in between the skin and the ice or the skin and the heat to protect that area. For some of my joint replacement patients, they may either have staples, sutures, or they could be glued back together. For these individuals, right after you have your joint replaced, you don't want to use any heat for the first 3 weeks or so because you're trying to get the swelling out of there. If you have an inflamed knee, we want to push that fluid out of there. And anytime you exercise, that's going to increase that microcirculation, increase those micro tears while you're doing the exercise, so that you should always ice after. So for some of my patients that either have arthritis or fibromyalgia, heat should be used because heat will help increase the range of motion and the flexibility and help to reduce some of that pain. For clients that have pitting edema, maybe from a past surgery or a past ankle injury where you can push in on the skin and it makes a little dent, and that little dent kind of stays there for a while, that would be pitting edema. For pitting edema, we would want to use a contrast bath. So you're actually going to use heat and ice. 4 minutes of heat to 1 minute of ice, and you do that for increments of 4 times. So you would do 4 minutes of heat, 1 minute of ice, and you would do that 4 times to make up that 20 minutes. The ending part of the contrast bath needs to be done with ice because the heat increases the blood flow and the circulation, causing a little bit of swelling. That ice pushes out that inflammation. Then you increase optimizing that oxygenated blood flow, that healing blood flow. Then you ice again to push that blood flow out, especially where you've had some of that stagnant blood. Because with pitting edema, what that blood turns into, it's almost more, instead of being like water and that you can kind of go back and forth, it's more like a syrupy, kind of stagnant, doesn't move as well. So the contrast bath really helps with that. Hopefully you've learned something today and something that you can use in the future. Have a great day.